At this moment, we will begin the exploration of the three-dimensional structure of a human body, addressing our esteemed colleagues and dedicated students who have joined us for this enlightening session. So, in general, the study of human anatomy, human skeleton, and human body involves analyzing their relationship to three mutually perpendicular planes of reference. In anatomy, proper study is when an individual is examined in the position where they are standing, namely the vertical orientation of the individual as observed on the screen, with palms oriented towards the front. This projection examines human anatomy. In this projection, we utilize a sagittal plane. From the word sagitta, arrow, sagittal plane, it runs along. That is the middle of a person's body. She divides the human body into two symmetrical halves. Right side and left side, that is, it moves alongside. Sagitta, which means arrow. This is one. The second projection, the second plane, it passes directly in front of the front. Forehead. That is, it passes perpendicular to this sagittal plane here, and it separates. That is, it passes like this here, the front, and separates the front half of the human body from the back. Anterior body, anterior, from the posterior. So, a sagitta, an arrow, it divides the human body into two symmetrical halves, right and left. Dexter and sinister, please. And the frontal plane, it passes through the front, through the forehead. That's how it passes. And divides the human body into front and back halves, anterior and posterior. We also possess a horizontal plane, dear colleagues, that separates the human body. That is the way it goes here. However, at any given level, that is, a horizontal plane, it separates, that is, it is perpendicular to both the sagittal and frontal planes. Therefore, all terms, all names, the study of human anatomy itself, yes, it will depend on the projection in which the person is located, in which projection, that is, these names, superficialis, profundus, right, left, dextra, sinistra, further, maximum distal, for example, maximum end close to the body, to the center, please. Here is the maximum end of the upper limb. Here it is maximum, and this is the distal end of the upper limb. Distal, remote. Moreover, dear students, there is such a concept as, let's say, lateral and medial, which refer to the sides of the body, specifically away from or toward the midline. Here is the medial projection. Approximate to the center, it is medial. Remote, it's lateral. The person's eyes are located more medially, while the ears are located more laterally. Lateral ears. So if we consider the human skeleton, dear students, how is it divided in the human skeleton? First of all, the human skeleton is divided into the axial skeleton, the axis that runs through the middle. That is, the axial skeleton of a human includes the skull, that's one, the vertebral column, that's two, and the thoracic cage, that is the ribs and sternum, that's three. Once again, I repeat, the axial skeleton is the vertebral column. Therefore, the skull, vertebral column, ribs, and sternum. And everything that is connected to the axial skeleton, everything that is connected is an accessory skeleton. What is included? Please. Attached is the skeletal structure of the upper limb belts and the unattached upper limb that is free of charge. You are aware that the belt of the upper limb comprises the clavicle and scapula. The belt of the unrestricted upper limb consists of the shoulder, forearm, and wrist. That is the entirety of it. Additionally, with regards to the lower extremity, what is connected to the axial skeleton? The bones of the pelvis, the bones of the pelvic girdle, and the bones of the lower extremity comprise the thigh, the shin, and the foot. Thus, dear students, the axial skeleton is the skull, vertebral column, ribs, and sternum. And an additional skeleton is a skeleton of the belt, free upper limbs, a skeleton that is of the pelvic girdle, and free lower limbs. This is all connected. So let's begin studying the axial skeleton collectively. Specifically, your initial practical lesson as a student commences with the most basic one. From the most elementary, this is the structure of the vertebral column, vertebrate column. Spinal column, colleagues, please pay attention. Here is the vertebral column, which serves as our backbone. Pay attention, which performs a supporting function, a protective function. We have high expectations for the spinal column. This is our posture, carrying out a fixing role, a supporting role. Pay attention to the load that the spinal column carries throughout an individual's lifetime. This is a sturdy, obstinate individual. All of the mass, all of the weight, all of this is applied to the spinal column. Not only that, what is he equipped with? The soft remnants, such as intervertebral discs, are positioned in the spaces between the vertebrae. These are unique shock absorbers that effectively soften impacts and cushion heavy loads. And all this mass of the body is gradually transferred. Where is it going? At the crossroads. Here's the sacrum. It's part of the spine. Please don't confuse, as many students often do. The sacrum consists of 5 fused sacral vertebrae. It is important to be aware of this fact. Furthermore, all of this mass, all of this heaviness is transmitted through the sacroiliac joint to the iliac bones, if you please, as requested. Further from the pelvic bones, it is transmitted through the hip joint to the lower extremities. And at each stage, students, there are their own shock absorbers here. Spinal table shock absorbers, intervertebral discs, fibrous pulpy rings that are contained. Here you will study all this in syndesmology. To comprehend osteology better makes understanding syndesmology, the science of bone connections, e.g. cartilage, menisci, discs, ligaments, easier for you. The subsequent stage. Kindly, the hip joint. There is such a bundle present. The ligamentum capitis femoris is located in this area, dear students and learners. Not only does it perform the functions of an intra-articular ligamentous apparatus, it is also a good shock absorber, additionally even under load. Do you understand? Because the vertical projection, all this mass settles, all this weight, it also carries a very heavy load, namely the hip joint. Ligamentum capitis femoris. The subsequent stage of the shock absorber is the meniscus, which are positioned in the area surrounding the knee joint. Lateral medial menisci, aligned by students and colleagues. Do you understand? These are soft freeze elements. Please pay attention to the load that they are carrying. The next stage in the process involves the arches of the foot. They are designed to provide cushioning and reduce the impacts experienced during walking, loading, and running activities. There is a pathology of flat feet. Flat feet should be treated at an early age while it is not yet strengthened. Specifically, the bone fibrous ligamentous apparatus of the foot, lower extremities, shin, various procedures. Do not be lazy, but you need to go specifically to orthopedists, traumatologists, and so on. So, let's start with studying the anatomy of the spinal column with you now. Dear students, you will not find the exact number of bones in the human skeleton anywhere, in any sources. This is a solid frame. Remember, a skeleton is a solid framework. Bundles, various cartilages, various intercostal membranes, various fascia, interfacial sheaths, intermuscular septa, menisci, discs. These are elements of the soft skeleton. You see, all of this is studied in the musculoskeletal system. So the human vertebral column, the columnar vertebral column, consists of 7 cervical vertebrae, 7 cervical vertebrae, 7 cervical, please, 7 cervical vertebrae. Next, we have 12 thoracic vertebrae, 12 thoracic vertebrae, please. Vertebra thoracis, that is cervical vertebra. Latin is a requirement, absolutely. Therefore, with the study of anatomy, you acquire a novel foreign language. Latin, bone of the vertebrae, please, kindly, thank you. So the cervical vertebra is called the cervical vertebra, please. Now thus, 7 cervical vertebrae. Next, we have the thoracic vertebrae. There are a total of 12 thoracic vertebrae. Please, here are thoracic vertebrae, students, colleagues. Next, further, lumbar vertebrae follow the person. These are the most powerful phalanges. There are 5 lumbar vertebrae. Please take a look. Vertebra lumbalis. 1, 2, 3, 4, 5. Here they are, 5 lumbar vertebrae in total. See how powerful they are. Next, dear students, we have sacral vertebrae. The sacrum is 5 fused sacral vertebrae with bodies and processes. Lastly, we possess vertebrae in the coccyx region, specifically vertebrae numbered 3 to 5. Therefore, we are unable to provide you with the precise number of bones in a human body because there are numerous anatomical variations in the skull and bones of the skull as well. For instance, there might be unstable bones in the skull. Next, coccyx, which is the tailbone of the sailboat. One person has 3 coccygeal vertebrae. The second has 4 coccygeal vertebrae. The third one even possesses a range of 3 to 5 coccygeal vertebrae, dear students. Thus, an imprecise quantity. Affirmative, there are still bones floating in the human body, specifically sesamoid bones, resembling peas, as you are aware. They are similar to peas, and they fulfill, you could say, a role of providing support in a supportive manner. The auxiliary role in movements, for example, between the phalanges of the joints, yes, these sesamoid bones. In the area of the phalanges of the joint, for example, the largest sesamoid bone in humans is the patella. Therefore, the knee joint is now considered not a complex joint, but a simple one. So, previously, how was it determined? If prior to this, it was believed that the quantity was different. So, whether a joint is simple or complex depends on the number of bones that are involved in the formation of this particular joint. And now, there isn't. And now the joint surfaces determine whether the joint is complex or simple. In the knee joint, we regarded the patella as a sesamoid bone structure. Yes, they were the third bone, the third little bone. Now it's gone. This is an extra device. 2 joint surfaces remain. The articular surface of the femoral condyles and the upper articular surface of the tibia. That is it. Bundles, menisci discs, sesamoid bone. This is similar to an auxiliary device. So, let's figure it out with you. Now we will choose some ringtone with you. Let's eliminate the additional, so let's eliminate the additional, so let's eliminate the additional, and contemplate a call with you. Here is a vertebra. Dear students, there exists a concept regarding the general plan for the structure of all vertebrae. What is the meaning of general plan? What comprises all the vertebrae? Independent cervical, thoracic, lumbar, sacral, and coccygeal departments. So all vertebrae possess a vertebral body. Please take into account that I am presently contemplating the overall structure of all vertebrae. All telephone calls have a body of the call. Please, here we have a vertebral body. The body of the vertebra is the vertebral body. Body, case, bell, vertebra. Body, case, bell, vertebra. Please, this is 1. Please note that the word count has been increased to 33. Further to the body, to the vertebra, dear students, it is fixed. Pay attention. Here it is. Arc, arch, piece. There is a great deal of Latin and Greek terminology in the Russian language, dear students. So you are extremely fortunate in this regard. Words like communism, socialism, these are all Latin terminology, colleagues. So, arcus, please, arcus, vertebral arch, vertebra, vertebrae, arcus, arc, vertebral arch, please. Here it is, vertebral arch. Now here it connects. The arc of the vertebra connects with what? It connects specifically to the body. Here are the legs. You see the legs. Here they are. The legs of the vertebra. The peduncle, the pedal, the leg. The peduncle of the vertebra. The peduncle, that is the arch of the vertebra. It connects through the legs of the vertebra to the body of the vertebra and forms the vertebral opening. That is, the vertebral foramen is formed. The vertebral foramen. Please be aware, beloved students, the vertebral foramen occurs when there is a single vertebra. And in the case of a fully formed spinal column, these vertebrae rest upon one another. These holes transform into a channel. Subsequently, The vertebral canal is created. Sewer, where is what? It's at the back of the brain. It's part of the spinal cord. It's part of the central nervous system. Pay attention to how the brain is protected from all sides. Located in the spinal canal. This is another function of the spinal column, specifically the function of providing protection. Who is she protecting? She guards the spinal cord, medulla spinalis from injuries, traumas, enters the spinal canal, and there are also many shock absorbers, venous plexuses found here. But let's not deviate from the topic stray. So, the arc of the vertebra, then further the legs of the vertebra. And now, beloved students, please pay attention because now we have sprouts. We possess spinal processes. As you can observe these different processes on the bones, we refer to them as bone apophyses. So there are both paired and unpaired appendages, even and odd. The vertebra has a single peculiar appendage. You observe it protrudes, descends similar to a thorn. There is a protruding axis, please. It is an outgrowth of bone. You should consume it as food. Return, consume, return, please. Offspring, come here and join me in this place. New words, child, process. You definitely need to get a dictionary. And make certain to write down each and every new word recorded in a notebook. Axis. Back, child, process, spiny appendage, process, spinosus. Here it is. That is, autistic processes have vertebrae. So we're considering the plan for constructing all the vertebrae with you. Cervical, thoracic, lumbar, sacral, coccygeal. So ostis to trostoxo, not in pairs alone. And now, dear student, let's continue and see now. Pair sprouts. Guys, you see they are moving in a transverse direction. Two branches are moving or something. Here they are positioned diagonally. What is it called? Lateral shoots. Crosswise. So, the word otrostock, we are familiar with you. And what about the processor? Crosswise. New word. Transversus. Transverse process. Transverse processes. Transverse process. Transverse processes. Transverse process. Dear students, dear students. Let's move on. Please note, dear students, we have two branches at the top. Dear students, so let's move on. Please take note, students, we have two shoots that are coming from above. Here they are, as we mentioned earlier. And we have two shoots emerging from beneath. What are these outgrowths? Kindly pay attention to them. The spinal column is a joint called synhadros. It is an important part of our body, providing support and protection to the spinal cord. So, let us come back in this manner. At the current moment, we have to. Negative response. So, the spinal column is a kind of joint where the vertebrae, each vertebra settling on each other, and they touch each other with the bodies of the vertebrae. And what else do they come into contact with? They come into contact with joint processes. Here are the processes related to the upper joint and the processes related to the lower joint. Now a small issue has emerged here. Upper joint process. The word is upper new. Superior. The term offspring. We are familiar with the process. Please, joint together. Articulation. Upper joint process. Superior articular process. Please, process of the upper joint. The process that is superior and articular. Lower joint process. The inferior articular process. Dear students, and why? They overlap in a manner similar to tiles. That is, the upper articular processes of the lower vertebra make contact with the lower articular processes of the upper vertebra. And in this manner, please, joints are formed. Joints that are long and well connected. Between these articular processes, upper and lower, with each vertebra, with adjacent vertebrae, arcuate joints are formed precisely by these joints. They are referred to as facet joints. Please note that there is a fibrous capsule that fixes them. But now, it's not about that. Currently, our main focus is to learn the general structure of the vertebrae. So, the upper joint process, the superior articular process, lower joint process, inferior articularis processor. Thus, we already know the transverse processes, the transverse brachii, go in a transverse direction. Upper joint process, process articularis, superior, please, here it is. lower joint process, process articularis inferior. Dear students, I will provide you with one trick. Your teacher has the ability to give you a call, for instance, in this projection, just like this. Be present with your own hands in this projection and verbally express and inquire, what are these shoots? You will say these are the upper joint processes, inaccurately the pair, incorrectly. You should answer the incoming phone call from your teacher and say, can you lend me, please, the phone call, take the phone call, flip the phone call, hold this phone call in the projection you are currently in without disconnecting from the ongoing call. So, dear students, it will be very convenient for you not to be given bones, vertebrae, scapula, ribs, in other words, all bone structures and so on. Hold them in the projection you are in which projection you are. Do you understand? And hold the handle as you are, in which projection, in this projection, it will be easy for you to determine which process it is, upper or lower, which surface it is, here. Some side, otherwise you will get confused. You may be deliberately presented with an inverted call and asked about some outgrowths. Here, e.g., here, some shoots, you'll say lower. No, these are the upper joint proc. We simply flip the call. So be sure to pay attention to this important information. So axis 100 branch hangs down, and pay attention to the call. Also pay attention to the side projections. Look at this. This particular cut is very eye-catching. Here it is, this cut that I mentioned earlier. Incision in the lower lumbar region. Excerpt newly added word surgical incision. Inferior vertebral incisure. Incision performed in the lower cervical region. Inferior vertebral incisure. And above, that is, in the region where the body and where the arc of the vertebra it passes, there is a lower vertebral notch. And in this location, well, let us say, there is a hardly detectable upper cervical notch that is barely noticeable. What are these cutouts? When our spine is fully formed and reaches its complete development, what exactly happens during this process? The lower vertebral notch of the upper vertebra settles on the upper vertebral notch of the lower vertebra, forming an intervertebral opening called the intervertebral foramen. This foramen serves as a pathway for the spinal nerves to exit from the spinal cord, providing a crucial connection between the two. Through these openings, spinal nerves and blood vessels emerge, which are precisely what becomes compressed in osteochondrosis with disc protrusion. Here, a hernia of intervertebral discs occurs. Yes, when the intervertebral disc loses this amorphous substance, masses flow out. These roots, spinal nerves, are compressed. The vertebrae settle. The distance between the vertebrae decreases. The bodies settle between the vertebrae. Then the intervertebral opening also decreases. And what passes here? Spinal cord nerves. And they are being crushed. Here is the reason for the pain. For example, the sciatic nerves. The branches that form the sciatic nerves in the lumbar region. When these osteochondroses form, what naturally arises? Lumbosciatica. Pressure on sciatic nerve. Specifically, it's a lower extremity pathology. A person can't walk with time. The vertebrae settle. That's why. So it has a crucial clinical significance. So, beloved students, we have talked with you about the overall plan of the structure of all vertebrae. The existence of a body, the existence of a vertebral arch, the existence of processes, transverse processes, spinous process, transverse process, superior articular process, inferior articular process. So, let us go Latin. Let us go the body of the vertebra, the vertebral body. Let us proceed with the Latin terms. Further, the arc of the spine, the vertebral arch. Next, the hole in the spine, that is the vertebral foramen. Furthermore, vertebrae legs, vertebrae peduncles, then transverse processes, transverse process. Further, ostistotrostok, processus spinosus. Next, the upper articular processes, processus articularis superior, joint, articulation, process, processus, upper, superior. Lower articular processes, processus articularis inferior, lateral projection of the vertebra, lower vertebral notch, incisura vertebralis inferior, and upper vertebral notch, incisura vertebralis superior. Dear students, at this moment, we will proceed to select the vertebral column together with all of you, our valued students. Here is the vertebral column in front of us. Now we will examine the anatomical features of vertebrae, considering their distinctive characteristics based on the specific section of the vertebral column in which each vertebra is located. This will allow us to gain a comprehensive understanding of the structural variations within the vertebral column. Depending on the specific department where this bell is located, dear students, the implications may vary. Here it is, please, here it is, please, we have it. That is, there is a concept. We have familiarized ourselves with the general plan of the structure of all vertebrae, these processes, etc. The concept of individual anatomical features is a significant aspect to consider. Distinctive features. In class, your teacher will call and ask about departments: cervical, thoracic, lumbar. You must identify the specific vertebrae, such as thoracic vertebrae and cervical vertebrae. This is a lumbar vertebra. How can you tell them apart? That is, the vertebrae, regardless of which department they are located in, have their own individual anatomical features. For instance, cervical vertebrae. Please, cervical vertebrae, we concurred with you. An individual possesses a total of 7 cervical vertebrae. Therefore, dear students, it is important to note that cervical vertebrae are considered atypical even upon initial observation. That is, they differ from the rest of the calls. So what are the atypical ones? It is the first, second cervical vertebrae, atlas and axis. They differ from the rest of the vertebrae. That is, there are distinctive features. That is, specifically the first 2 cervical vertebrae, they differ in shape. From the rest, for example, a small load is being intensified. Therefore, they differ in small sizes. They are more flexible. Then the first cervical vertebra is the atlas. Why was it named Atlanta? And he carries a skull on his own person. Cranium, see? Here they are, the upper joint surfaces of the skeletal structure. Here are the occipital bone men go. And the joint between the atlas and the occipital bone is formed, which is the articulation of the atlanto-occipital joint. Yes, the powerful joint and atlas, along with the skull, rotate around their axis when we turn our head to the right and left, facilitating a wide range of motion for us. So, the first cervical vertebra is called the atlas, paralsta. The bodies of the cervical vertebrae gradually increase around the 3rd and 7th cervical vertebrae as they progress. And their upper processes, that is, the upper and lower surfaces, are concave in a saddle-shaped manner. As for the arches, by connecting with the bodies of the vertebrae, limit these triangular oval spinal openings. So, the characteristic distinguishing feature of cervical vertebrae from all respected students is the presence, pay attention, of holes in the transverse processes of cervical vertebrae. Here are the holes, here they are: foramino transversaria, or foramino cos transversaria, or foramino processus transversus. And why did it get this name? Here, look, we were discussing the overall plan for the structure of all vertebrae, right? Presence of a vertebral body there, arch of the vertebra, presence of transverse processes, articular processes, upper, lower. In principle, I'm able to state that all of this is present within the initial cervical vertebra, but they have undergone modifications. Modified. Please, for instance, for example, let's assume, well, yes, there is a front arc and a rear arc, just to give you an idea. Anterior arch, posterior arch, please. There is no body, but the body of the first cervical vertebra, it migrated to the second one in the vertebral column. And why? Turned into a tooth. The tooth of the second cervical vertebra, tooth-shaped, is the former body of the first cervical vertebra in the embryonic period. And here, please, the front bump. Tuberculoma anterior. So the posterior tubercle, the tuberculum posticum of the first cervical vertebra, is a modified bony process of the spinous process. There exists a parallel. There is a general plan of the structure, but it undergoes modifications. For the cervical department, the vertebrae require such a structure that determines their anatomical and physiological characteristics. Due to the fact that the cervical and lumbar sections are characterized by higher mobility in the human body. Moreover, there is cervical lordosis here. It is the rotation of the skull around the vertical axis. It's torsion rotation. Let's pay attention to the shoots. Here are the transverse processes we were talking about. General plan of the structure of transverse processes, transversus process. But there is a hole in the transverse processes of the cervical vertebrae. The primary distinguishing feature of cervical vertebrae is the hole. Through these holes, the 7 cervical vertebrae have a hole. The spinal artery passes through the vertebral artery. This is an additional source contributing to human brain development. The main one is the sleepy artery. An additional one forms an anastomosis. At the base of the brain, in the circle of Willis, it merges precisely with the arteries. 2 arteries merge, the basilar artery is formed, then it diverges into the posterior cerebral arteries, connects through the branches of the middle and anterior cerebral arteries, forming the circle of Willis, and anastomosis with the internal carotid artery. Here you go, please, and the reason. Now we have an understanding of what vertebral basilar insufficiency is, which occurs when the vertebral artery is compressed as a result of osteophytes growing in this canal. Please, that is the spinal canal. It is a massager for this very canal, not the spinal canal. I'm confused. The spinal canal is this one, canalis vertebralis. The transverse processes channel, the osteofibrous channel, formed by the opening from the processes, serves as a massager and exerciser for the vertebral artery. Passing through this channel, branching off from the subclavian artery, enters the cranial cavity. And here is a sulcus. For the vertebral artery, it enters at the first cervical vertebra, and 2 vertebral arteries merge, forming the basilar artery, and also participate in the formation of anastomosis. However, please be attentive. How are transverse processes formed on the first cervical vertebra? Here we have a frontal process. This frontal process is a rudimentary structure resembling a rib. Rudimentary rib process, and the rear one is called, this front one is called the costal process. That is the rudiment of the rib. And the rear one is the transverse process. That is the transverse process in the cervical vertebrae is formed as a result of the fusion of the rudimentary rib process and the transverse. Therefore, it can be called the processus vonomen transversus process. You can refer to it as a phonomen costotransversarius. In other words, it is the opening of the rib cross process. That is rudimentary. They are rudimentary. Occasionally, there is even a return of the item. When an individual, for instance, we mentioned 12 on the periphery, cervical ribs manifest in the human body. Cervical ribs, which are attached to the cervical vertebrae, please. Moreover, when we reach the lumbar vertebrae, imagine the transverse processes of the lumbar vertebrae. It is the processus costiformis. These are also rudimentary rib processes, dear students. Here they are, distinctive features, please. So, with the transverse process, it's clear, an important anatomical feature, distinctive. So, plus, the cervical vertebrae have bony processes. They split, that is, they bifurcate, right? Here they split, as if they were doubling, yes. This means, of course, the first cervical vertebra and the articular processes. In fact, you don't see here distinguishing upper and lower joint processes. They're immediately called a joint process. Although it is slightly there, a millimeter there, and it is visible. These are joint processes. See the lower joint processes and upper joint processes, but here they are not highlighted. We refer to them as modified joint surfaces. Therefore, the overall plan of action remains intact for telephone conversations. Regardless of the opinions of others, they are students who are held in high regard. Here, and at the first cervical vertebra, and at the second cervical vertebra. And pay attention, dear students. Here, at the first cervical vertebra, in the area of the anterior tubercle, there is a dental fossa, a tooth socket. Tooth. Where did he come from? The tooth has a second cervical vertebra. Axis, or what is it called? Epistrophius. It's a tooth. And this tooth was a former body. It belonged to the first cervical vertebra. It went to the second cervical vertebra, and now the articular surface of the second cervical vertebra tooth. Its front surface. It is precisely the pit of the first cervical vertebra that comes into contact and forms the atlantoaxial joint, the articulation of the atlantoaxial joint. It transpires that the initial cervical vertebra, in conjunction with the cranium, rotates around the axis of the tooth during the movement of turning our head left and right around the axis of the tooth. He rotates the second cervical vertebra, So, with respect to, dear students, the first cervical vertebra of Atlanta, let's discuss it. Well, it appears that is all. Dear students, my advice to you: the greater your knowledge of osteology, the simpler it will be for you to comprehend syndesmology and so forth. That is, you will already understand what syndesmology represents. That is the science of bone connections. There are the same bones, but with a ligament apparatus. If you don't know the bone, how will you define what it is formed by, for example, the atlanto-occipital joint? What it is formed by, for example, the atlantoaxial joint? Require a competent joint definition. How is the correct joint definition determined? First, you need to specifically name those parts of the bones directly involved in the formation of this joint, not just like that. The shoulder joint is formed by the articular surface, the articular cavity of the scapula, and the articular surface of the head of the humerus, with the proximal head. Additionally, there is a distal capitulum of the humerus. Imagine yourself, not like that. Shoulder joint formed by scapula and humerus. This is wrong. Those portions of the bones that are directly involved in the process of forming this joint. This is the manner in which joints should be defined. And if we do not take osteology seriously, you will not have the capability to give a definition. The better prepared you are for osteology, the easier it is for you to understand. You will be clicking on syndesmology, please. Hooray, resurrence, the second cervical vertebra, promising, here it is, a tooth. Dens, which enters the pit of the tooth of the first cervical vertebra and forms the joint between the atlas and axis bones. The second cervical vertebra, it is called the axis, has an additional name, epistrophius. What does he differ in? For example, it has a tooth-like projection on the upper surface. This is one. However, the transverse processes are also identical. They repeat in a similar manner. Pay attention to transverse processes, presence of holes. Here, holes in students' transverse processes. Here, what does a tooth have? Pay attention, there is a front joint surface, here it is, which fits into the tooth socket. There is a posterior articular surface, and in this area, we have the transverse ligament of the atlas present. Transverse ligament of the atlas. That is, this tooth-like process, so to speak, is positioned, so to speak, in the space between the tooth socket and the transverse ligament of the atlas. Transverse ligament of the atlas. And such a cylindrical joint is formed. Incidentally, this happens to be the central atlantoaxial joint, just so you know. There is also a lateral. What about the lateral? And here they are, here they are, here they are. The lateral articular surfaces of the second cervical vertebra. Also available, here they are, upper articular surfaces of the second cervical vertebra. They articulate with the lower articular surfaces of the atlas. Furthermore, the formation of the lateral atlantoaxial joint takes place. This is the central atlantoaxial joint. Well, Then there is the presence of a ligament apparatus and so on. But note that his spinous process is bifurcated at the second cervical vertebra. See what bifurcated leafy appendages, so transverse processes. There is a front bump again, a rear bump. What they correspond to, we reached an agreement with you. The frontal tubercle is a rib remnant. The posterior tubercle is a transverse process. This is a whole, meaning it is edge transverse processes. That is, remnants in the student area. But in principle, what else? In principle, dear students, we have already covered the first and second cervical vertebrae, what you should pay attention to. 1-2 cervical vertebrae are atypical. The absence of a body, although they have bodies, they are modified. The first cervical vertebra's body went to the second, it's a tooth. Transverse processes are transverse. There are osteophytes, they are bifurcated. So, but the rest of the components are as usual the vertebral foramen. This is the vertebral arch. The cervical vertebrae have front and rear arches first. Well, what can you do? Such is the cervical department of the spine, performing a flexible function. Coming back, at this juncture we have a great deal of interest, dear students. So we tidy up the remaining part together. So, are you interested in the chest? If possible, please provide information on the chest department, thoracic spine, and thoracic vertebrae. Thank you. Here they are, thoracic vertebrae. Now I will enlarge it for you. Dear students, future luminaries of medicine, future professors, academics, and the main distinguishing feature of the thoracic vertebrae from all is what? The presence of edge pits is observed. Yes, edge pits are indeed present in the sample under examination. Just a vertebral body. The vertebra body. Pay attention. Here it is, the vertebra body. Here is the body of the vertebra, the vertebral body. The presence of a costal fossa on the body of the vertebra. This is the upper costal fossa and the lower costal fossa. And the presence of costal fossae on the transverse processes. The transverse process, please. When it comes to versus parostra, the question arises, why? And the answer lies in what is fixed in our thoracic vertebrae, which is vital for understanding the significance of this phenomenon. Ribs, a total of 12 pairs of ribs are securely fixed behind the thoracic vertebrae. And to fix these edges to the thoracic vertebrae, like a key to a lock, there are corresponding pits on the body of the vertebra and on the transverse process. What pits? Edge pits. Phobia. Edge. What are they? They're edge pits. I fear edges. Costa. Phobia of costalis in the frame of a student. Edge pits. Phobia of bones. Parallel. This must be remembered. That is, they, like a key to a lock, fit precisely these edges on the body of these vertebrae and on the transverse processes. Parallel. As an illustration, we designate it, for instance, as an edge pit, and this is precisely where it is located, a transverse process. We are aware of the transverse process, also known as processus transversus. It has an edge pit. Edge. Rib, dear students, rib is a bone. Please, rib, costa. So the costal fossa is actually the fovea costalis, and now let's connect these two. The fovea is a small depression that is situated on the transverse process, which is a bony projection of the vertebra. That's it, costal facet of transverse process. Transverse process fossa, please. On the transverse processes, students, here they are. So let's reduce the count. And also plus ribbed pits. Pay attention to the body of the vertebra. Vertebral body. There is an upper edge pit. Foveo-costalis superior. There is a groove at the lower edge. Foveo-costalis inferior. Nevertheless, however, there is always this but. In a specific location, we are currently being pursued. To all the dear students, I want to emphasize that the crucial thing is, in actuality, that rib pits have not only the first thoracic vertebra, but also the 11th and 12th vertebrae in the spinal column. And the remaining vertebrae, starting from the 2nd and ending at the 10th, possess half pits. I reiterate, the costal fossa is a depression on the surface of the body that contains the first thoracic vertebra and the 11th and 12th thoracic vertebrae. From 2nd to 10th thoracic vertebrae, there are half cavities. 2 to 10 thoracic vertebrae have half pits, i.e., the word poluyamka means the lower half of the body of the upper thoracic vertebra is combined with the upper half of the lower vertebra and forms a complete hollow. Poluyamka is a term used to describe this anatomical feature. In other words, when you combine half a pit with another half a pit, you get a complete pit where the head of the rib is situated or placed. Do you recall? Do you recall? I reiterate, my dear students, please remember, the first thoracic vertebra, the 11th and 12th thoracic vertebrae, they have pits. Fovea costalis. And commencing from the 2nd to the 10th thoracic vertebrae, there are in reality half cavities. And here are two half cavities of neighboring vertebrae, the upper vertebra and the lower vertebra. They form the cavity itself in its entirety. But we don't call it a half bowl there. That is, regardless of whether it is the first thoracic vertebra, the 3rd, 4th, 5th, 10th, 11th. Everywhere we refer to them as potholes. Phobias persist. However, what you are referring to when examining the borders, Kostya, is a size of 12 measured from the edges. The ribs are attached to the vertebrae, here. And here it is, exactly, there is a whole pit in the first thoracic vertebra. 12, 11, 12, there are intact pits there. 11, 12 vertebrae, and there are whole pits. The rest from 2 to 10 have half pits there. At the edges that are formed, that are hit, where exactly rib vertebral joints are formed, the rib is fixed to the vertebra in two places, precisely on the rib fossa, on the body of the vertebra, and the rib fossa of the transverse process. Forms rib vertebral joints and rib transverse joints, that is, the joint of the head and rib transverse joints. Here the joint, the head, and the ribs fit into the rib fossa on the body of the vertebra, Here is the initial rib, the first rib. It is complete. It forms a spherical joint with the first thoracic vertebra because there is a complete cavity in that location. And the 12th, 11th, 12th thoracic vertebrae too, where the ribs are fixed, 11th, 12th, there is a spherical joint. And the remaining edges, they possess heads, edges, carpet bones. They possess a crest that divides the articular surface of the heads and ribs into two articular surfaces of such nature and characteristics. One big, the other small, and of course they come together at this place. And why is that? And these articular surfaces, starting from the 2nd to the 10th, fit into the semicircular grooves. Vertebrae. So what kind of joints are already here? Saddle-shaped. The first thoracic vertebra, the 11th and 12th thoracic vertebra, dear students, here are ball joints. From the 2nd to the 10th vertebrae, where the ribs are attached to the vertebrae, they are saddle-shaped. Therefore, please keep in mind the primary distinguishing characteristics of the thoracic vertebrae. The presence of pits in the vertebral body, upper and lower vertebral regions, as well as the existence of a transverse pit in the vertebral region of the spine. Fovea costalis processus transversus. Recall this characteristic, beloved students. So, we are quickly running out of time. Dear students, lumbar vertebrae, the most powerful department, please make sure to choose a lumbar vertebra. Time is running out rapidly. So, lumbar vertebra, the rest we throw away. So here they are, lumbar vertebrae. 5 lumbar vertebrae. Vertebral lumbar, dear students, look at their bodies, the most powerful. Do you perceive how they are? They carry such a burden. That is the reason why the most prevalent form of osteochondrosis occurs in the lumbar region. The complete weight of the body is a load on, the lumbar vertebrae, on the discs that are positioned between the lumbar vertebrae. So, the The primary distinguishing characteristic. Look here, let's review the overall plan now. Well, of course we know. Look here, body vertebra, please. So the vertebral body, the foraminal openings on the vertebrae. Further supposedly transverse processes of transverse process. Upper joint processes are superior articular. Lower articular processes of the inferior articular process. Lower vertebral notch, upper vertebral notch, spinous processes. Hooray, my students! One of the distinctive features is their large sizes. First and foremost, they stand out due to their significant dimensions. Attention! Individuals requiring large sizes, kindly take note, this is one item. Furthermore, the transverse process of the lumbar vertebrae, specifically the transverse processes, can be identified as processes associated with the ribs. More precisely, you know what I'll tell you? More precisely, in the lumbar region, a transverse process formed as a result of the fusion of the costal process and the transverse process. Edge, that is, the edge process is even more extensive in size and scope than the transverse process. Do you comprehend? Here it is. And at this particular point in time, an additional processus accessorius emerges in close proximity to the lumbar vertebrae. And in that location where the upper joint processes and also the nipple-like processus mobiliaris can be found. So, I reiterate once again, dear students, the characteristic that distinguishes the lumbar vertebrae from others is, and make sure to pay attention to how the joint processes are positioned. They are almost nearly in the sagittal plane. See? Sagittal plane. How are shingles laid atop each other? Here they are, here they are. Torsion. Movement, please. Here they are. Upper joint processes. That is, the transverse processes of the lumbar vertebrae are called the processus costiformis. The processus costiformis is formed, by the way, from the influence of the transverse process and the rudimentary rib process, plus there is the processus articularis superior on the upper articular processes. So what? Affirmative, 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 affirmative. Nipple-like processus mammillaris. The process of bone formation is less extensive in the lumbar vertebrae. Appendage processus accessories, dear students. So what else? Well, yes, there is nothing to say. Powerful very vertebrae, dear students. Recall, there are 5 lumbar vertebrae. So students, time is crucial, time is precious. So, let's proceed. Go further. We emphasize the sacrum. We emphasize the sacrum. The students are astonished. We emphasize the sacrum. We remove everything else. So, the thing is that a large number of students, they often get confused. They frequently make mistakes and encounter difficulties. In what manner? Sacrum, dear students, this is an extension and continuation of the vertebral column structure. It's clear, yes, it's a single bone. But when many students, when asked to list the sections of the spine, they mention the cervical, thoracic, lumbar, but for some reason they forget the sacrum. Nothing like that. The cross also has its own processes, bodies, openings, transverse processes, spinous processes, upper joint and lower joint. However, the fact is that the processes, these structures of the vertebrae, have undergone fusion and merged together, forming a single bone in the process. They fuse together with their bodies, first, second, and third lumbar vertebrae, fourth and fifth. Pay attention, that is the sacrum bone. What is the sacrum bone? These are 5 short telephone calls between bodies. This is 1. By arcs, it is 2. Dear students, teenagers, there are 3 of them. These are the facts. The shoots have grown together, and thus, when they grow together, new formations are formed. You simply need to learn the overall structure of all vertebrae, then immediately learn the sacrum. Well, first of all, the sacrum has a wedge shape. See? Clean. This part is called the base of the font, respected student. Here is the foundation. Foundation ossis sacra. This portion is referred to as the top. Apex ossis sacra, dear student. Next. So these are our lateral parts. Part, pars, lat, pars, lat. Here is this part, please. Here is the report, please. Here we have wings, ala, please. Wings, ala, here they are. Furthermore, dear students, this part is called here, this surface at the sacrum looks towards the pelvic area. Pelvis. Therefore, calling such a smooth surface, the pelvic surface of the sacrum is called. Surface of the face, pelvis, fascia of the pelvis, perusa, or the anterior surface of the fascia anterior of the pelvis area. When you're studying anatomy, it's essential to have a dictionary. Make sure to thoroughly understand the front, back, lateral, medial surfaces, as well as the deep and distal aspects. Memorize this terminology, and it will become ingrained for life. With this knowledge, navigating anatomy will be a breeze. For life, while you are employed as medical professionals, it is imperative to reiterate all of this. It always forgets all of this. And naturally, dear students, we must consistently learn all of this together with you. So the top of the sacrum, the base of the sacrum, pay attention, there are students in the area. Present here is a mid-sacral crest known as Grista sacralis mediana, which is situated in the middle of the sacrum bone. From which place did he come? These are 5, 4, 6, 8 processes of the sacral vertebrae. Please, you will be asked to explain the meaning of Grista sacralis mediana when prompted. This is the middle of the pubic crest. Where did he come from? And these are 5 short ossified shoots, 5 sacral vertebrae. This is one. Next, slightly more laterally is the intermediate sacral crest. Gristos acralis intermedia. What is this? Where did he come from? These are the fused upper and lower sacral, meaning articular processes of the 5 sacral vertebrae in the human spine. Articular processes of the joint process, and an intermediate sacral crest formed. Please, you are our students, and ultimately Grisosacralis lateralis at last. Where did he come from? Grisosacralis lateralis, lateral sacral crest. And these are fused 5 transverse processes, 5 sacral vertebrae. That is where these ridges on the posterior surface of the sacrum originated from. Median sacral crest, intermediate sacral crest, and lateral sacral crest. During the study of pelvic bones, you will come across an ear-shaped surface, which is the same ear-shaped surface that you encountered earlier in your studies. Pelvic bones, air-filled bones, they are similar to a mirror image. Display one another. This is precisely the location where the sacroiliac joint is formed. The sacroiliac joint, the sacrum, here it is. The auricular fascia is present both in the sacrum and in the iliac bone, which is part of the pelvic bones. The exit openings of the foramino-sacral, pelvic or anterior, from which the spinal nerves and foramino-sacral dorsal nerves specifically emerge and exit the body. Through these holes, the foraminous students emerge. So, foramen students, regarding the edges. So, recall, an individual possesses a total of 12 pairs of ribs, 1 rib, and multiple bones. How do they divide? Edges are divided into those that are fixed to the sternum. These are true ribs. Costa vera, this is one. The ribs that are fixed by cartilage in the surviving ribs are the 8th, 9th, and 10th ribs, which are false ribs, also known as the spurious rib. Lastly, there are ribs that are not fixed anywhere and end in the muscles of the abdominal wall. These are fluctuating ribs, also known as costae fluctuantes. True ribs, a total of 7, are attached to the sternum. Therefore, these ribs constitute the first 7 pairs of edges. Following that, the 8th, 9th, and 10th false edges. Cartilage above the upper ribs. And finally, the fluctuating ribs, the fluctuating bones. They end in the muscles of the abdominal wall. The head of the rib. The rib possesses, dear students, a neck of the rib. The rib possesses, dear students, therefore, the angle of the rib bone structure. In parallel, here they are. Specifically, the rib head, sail, sternum, skull bones, neck, and bone knob stand out as noteworthy. Next, Dull as a bullet, that is, a rib bump. Next, Rama students turn the corner with their heads down. This part is called the body of the rib in Rama students. The thing is, the head of the rib fits into the rib fossa on the body of the thoracic vertebra, while the rib tubercle fits into the transverse process rib fossa. Here, the head of the rib forms precisely the joint of the head of the rib, and the rib bump forms rib cross joints, like a key to a lock. Here it is, please, the distinctive feature. This is a distinctive feature, but as for the sternum, I hope you will understand. The chest with thorns is comprised of a handle for the chest, the manubrium of the sternum, the body of the sternum, the corpus sterni, and the xiphoid process. What is located on the chest? Once the edges are fixed, there are edge cuts, rib, edge cut, incisure, costal incisure. That's one of the features found on the chest. And further, pay attention on the chest from above. Here, this place obtained the name of the brisket, the jugular notch. These are two. And further, where the clavicle is fixed, the hand, therefore, in the sternum of the manubrium. It was given the name incisura claviculi, incision meaning a cut in the shape of a keyhole, a cut resembling a yoke, a keyhole cut, and cuts in the ribs were the procedures performed. Within the frame are the students. As a result, we have successfully concluded our first lesson, which adheres to both the calendar and thematic plan that has been established and outlined for the course. Next, it will be even more interesting. Next, please look, observe the calendar thematic plan. What is the subject matter? We will keep investigating this topic jointly, and with every lesson, our understanding of Latin terminology will grow. New names, new words, new sentences. Therefore, everything depends on how we will start working from the first lesson. With each lesson, everything will become more complex, and the burden of new Latin terminology will grow. Thanks for your attention. Goodbye. Until we meet again, we'll meet in a week. Good luck and success.